Hello, everyone. My name is Ashmita, and I'm a research project coordinator from the University of British Columbia. This research study was conducted as a partial fulfillment requirement for my master's degree, and the title of my presentation is Engaging Service Users Aged 50 Years and Over in Mental Health Care and Policy. Before we start with the presentation, I would like to acknowledge that I am presenting from the traditional, ancestral, and unceded territory of the Silks Nation, Okanagan. I also would like to acknowledge my supervisor and committee members for their guidance throughout the writing of this thesis. And I also would like to thank my participants for their valuable input in this study. Here's an overview of the presentation. First, I will provide the background information of the study, followed by the objectives and methodologies used, and then the results, next steps, and conclusion. Poor mental health in adults aged 50 years and over is a major concern in Canada. And 1 in every 5 individuals experience or have experienced mental health concerns in their lifetime. 1 in every 2 individuals experience or will experience mental health concerns by the time they reach 40 years of age. It is also estimated that over the next 3 decades, almost 20.5% of the total population will experience mental health concerns, primarily due to aging and chronic illnesses. Some other factors that affect the mental health of adults aged 50 years and over are life transitions such as empty nesting, loss of loved ones, and relocation to care homes. Almost 35.5% of the total population are 50 years and over in Canada, and the highest rate of suicide is in 50 to 54 years of age. Service user engagement and mental health policy has become a key principle. And even though many mental health organizations, such as Mental Health Commission of Canada, support the engagement of people with lived experiences of mental health concerns in mental health policy, the evidence of its implementation is rarely seen in practice. There is a lack of age-appropriate mental health services and policies for this age group, and there is a lack of comprehensive research in this area. There are mental health policies and services for adults who are 65 years and over. However, the mental health policy and services for adults aged 50 to 64 years is missing. The main objectives of the study were to understand if and how mental health service users are engaged or want to be engaged in mental health policy in British Columbia, and to explore the lived experiences of service users in receiving mental health services and supports in BC. For the purpose of the study, service users were defined as people living with mental health conditions or people who have lived experiences of mental health concerns, their family, and caregivers. Data were collected using qualitative descriptive methodology to gain first-hand information and rich descriptions from the participants. Semi-structured interviews were conducted with 15 participants until data saturation. Purposive sampling was used to recruit the participants via patient advocacy platforms such as Patient Voices Network in BC and Reach BC. The opportunity to participate in the study was also posted in social media, for example, Facebook, and snowball sampling through the recommendations of the participants were also used to meet the sample requirement. Thematic analysis was used to analyze the data, and there was an emphasis on gender differences and similarities. The 3 pillars of public participation by International Association of Public Participation was used as a framework for the data analysis. The interview data yielded to 3 key themes. The first theme is mental health and well-being, where the participants identified the positive and negative factors that impacted their mental health and the impact on their family and caregivers. The positive and negative factors of a global pandemic was also described by the participants. Our second theme is mental health services and supports. The participants shared their lived experiences with mental health care, and many gaps in mental health care were identified by the participants, such as challenges in timely access to mental health services, lack of patient-centered care, lack of continuity and coordination of care, improper management of medication, and the cost of services. Our third theme is service user engagement, where the participants shared their experiences of engagement in mental health care and policy. Barriers to micro, meso, and macro level of engagement were also identified. For the purpose of the study, micro level engagement refers to service user engagement in decision-making about their own care, for example, choosing a therapist or choosing a treatment. Meso-level engagement refers to service user engagement in mental health policy in mental health care organization. For example, representation of patients in the board of committee of a hospital, etc. Macro-level engagement refers to the service user engagement in mental health policies, for example, co-developing the mental health policies. This figure represents the results based on the IAP2 spectrum of public participation. And at micro level, most participants were not given information on their mental health concerns, and they were not aware of their mental health team. They were not consulted for feedback on the services being received and were not engaged in the planning of the care. Some participants who had one-to-one care were engaged in the planning of their own care. Efforts to be engaged were ignored by the mental health providers, and they were not empowered. There were some participants who were engaged at meso and macro level. The participants who were engaged were provided with background information about their engagement. However, their roles were not clear. And at meso level, they were consulted and their feedback were not taken into consideration. Whereas the participant who was engaged at macro level was consulted and their feedback was taken into consideration while they were on the committee. They were engaged and understood, and however, the changes in policy and processes were not always discussed. At meso level, the participants were not empowered and they were unaware of the decisions made as a result of their engagement. One of the participants who was engaged in meso and macro level stated that if they're not engaged in mental health policy, then their needs are often missed. Barriers and facilitators were identified by the participants at all levels. At micro level, language, ageism, accountability, and commitment were found to be the major barriers, whereas at macro and meso levels, lack of opportunities, lack of awareness and adequate information, lack of change in policy, bureaucracy, tokenism, difficult getting into committees, technological barriers, and patients' mental well-being were considered as the main barriers. When these barriers are addressed, they can also act as the facilitators to enhance service users' engagement in mental health policy. Our next step is to share the findings broadly via publications, infographics, plain language summary, video, and through social media platforms. Presentations at various conferences and webinars will also be conducted to share the findings of the study. In conclusion, more work is needed around service user engagement and mental health policy activities, and the results of this study can be utilized to enhance service user engagement and mental health policy activities and to improve mental health service delivery for better mental health outcomes. The findings have the potential to guide policymakers, decision makers, and healthcare providers in developing proactive approaches for the mental health of adults aged 50 years and over. And here are the references that I used in the presentation. That's the end of the presentation. If you have any questions, please feel free to email me at ashmita.rai@ubc.ca. Here's the QR code to my thesis. You can scan the code through your phone and get access to my full thesis in the library of University of British Columbia. Thank you.